Hello and welcome to the Scottsdale Top Docs podcast, where in each episode we focus on bringing you the very best education on evidence-based medicine with the mission of helping you, our listeners, lead healthier, more informed lives. This episode was brought to you by Brook Choulet, the performance psychiatrist. Dr. Brook specializes in performance psychiatry for children, adolescents, and adults. She's also known for her role as team psychiatrist for the NBA Phoenix Suns and Phoenix Mercury. Find out more at Scottsdale Top Docs on Facebook, Instagram, or our YouTube channel. And on to today's episode.
Hello, and welcome to the Scottsdale Top Docs podcast. I'm Dr. Choulet, your host for today's episode. I'm honored to host this episode with my guest and friend, Dr. Roni Prucz. Dr. Prucz is an award-winning, board-certified cosmetic and reconstructive plastic surgeon. He studied engineering at Duke, went on to medical school at Johns Hopkins, and then completed plastic and reconstructive surgery training at the University of Washington. Dr. Prucz owns Phoenix Plastic Surgery and offers several procedures targeting face, breast, and body. So before we dive into things, can you tell us a little bit about why you love what you do?
Yeah, for sure. So I think the neat thing about my practice is that I get to do cosmetic procedures and help people feel and look better, but then also get to do reconstructive procedures to actually put people back together. So, my typical day, I'll do a couple cosmetic procedures in the morning, and then I'm usually helping one of my surgical colleagues in the afternoon. And I think that's also a really neat part of my practice that I enjoy is I have neurosurgeons calling me, orthopedic surgeons calling me, vascular surgeons calling, all sorts of different specialties because they know that I can help them do what they need to do. So it's almost empowering other surgeons to offer the procedures that they normally wouldn't offer or be hesitating to offer because they know that no matter what they do, I can pretty much come in and fix it.
Yeah, that's awesome. So if we back up to before someone even finds you, right? So let's say I'm looking for a mommy makeover and I want to fix my post-pregnancy body. How do I even go about finding a good plastic surgeon?
Yeah, that's a great question. So I think your initial screening tool is find someone that's certified by the American Board of Plastic Surgery. So, then that's the only recognized board for the plastic surgery subspecialty. There are other boards out there, and those are cosmetic boards where someone can maybe do a training for a week or a year and get a cosmetic board certification. But that's not a true American Board of Plastic Surgery certified person. So I think if you're initially screening, that's where you start. You go to the American Board of Plastic Surgery website, look in your area and see the physicians. I think the next thing to do would then be a Google review. I mean, Google has kind of everything there, right? Yeah. So I don't think that the great reviews are helpful. I think it's the negative reviews that are helpful because I know a lot of surgeons out there that they may or may not be the best surgeon, but their Google reviews are amazing. So that's not really helpful for a common person looking through things. But the negative reviews tend to be pretty true. So if you see several negative reviews for somebody, that's definitely a red flag, I would say. Especially if they're talking about the physician themselves. I think I have maybe one or two, but they're not even about me. They're about a patient who had to wait too long or something along those lines. So It wasn't about anything I did or did not do. And then I think the next thing, word of mouth, kind of asking around and seeing what other people think. The truth of the matter, though, is the majority of the public doesn't really know. It's other physicians. Mm-hmm. So if you have a friend who's an anesthesiologist, that's the gold mine right there because they work with all of us and they know everything about us. Or any OR nurse. They also will definitely know kind of who's doing it right and who's not. So awesome. I think that's kind of the initial screening that I would go through.
Okay, that's helpful. So after looking at the American Board of Plastic Surgery, did I get that right?
You got it. Nailed it.
So then, I think what we could take away from that is it doesn't matter how pretty the website is or how much money someone spent on a website, but making sure they have the right qualifications. Because how many years of training did you go through?
Yeah, that's actually a really great point too. So, I did 4 years of engineering at Duke. And then we did medical school at Johns Hopkins and then training at the University of Washington. So it ends up being 14 years before you even are able to start operating independently.
Okay.
And I think, another thing is to look at the institutions. And I know that's a little bit difficult to do, again, if you're not in the medical world. But if you're seeing names that you recognize, if you're seeing Dukes and Harvards and Yales, that's probably a well-qualified person. Now, there's an offset to that. Sometimes those who are really good at school are not that good in the operating room.
Right.
So once again, it's difficult, but for the most part, it's a good way to kind of look to if you're seeing schools that you recognize and training programs that you're like, oh yeah, I've heard of that. that's probably a good sign that that person's at least been in legitimate programs and, made it through to the point where they're now safely operating.
Right. And that makes sense too. It takes me back to like what went off in my mind's bedside manner. So like I personally, it's like, it doesn't matter the bedside manner if they're incredible at what they do. But what patients get coming to you is bedside manner and kind of that ability to both do reconstruction and cosmetics. So let's say I've called your office, I made a consult. Now is kind of, I'm coming to the consult. What are like some common questions that you get, or what should people be asking?
Yeah. So I think the consultation process is different between every physician. I think one of the things that really sets us apart is the fact that I'm super friendly and playful. So you're going to be greeted with a smile. I'm probably going to joke around with you for a little while. We have patients that literally yesterday actually was my clinic, and we had a patient who 6 months ago had surgery, and she said how excited she was to come see us again. She like missed us. She's like, how are you guys all been? We get a lot of people bringing cookies and things like that. And don't bring cookies, please. I'm trying to lose weight. But thank you for those who do. We get a lot of that. And I think, when you go, I think as a patient, there's a few things. One, do you feel good in that office? Because the plastic surgeon that you choose, regardless of how good they are in the operating room, you got to go to that office. You got to deal with that staff. You got to be friends with them for several months. So if you're not comfortable in that place, if the juju is wrong, or you're just not feeling like this is right, then that's probably not the right office for you. I think in terms of kind of the questions, is again, make sure they're board certified. Have a clear goal of what you're looking for. So I always ask patients, like, what brings you in to say hi to me today? Like, what are you thinking about? Mm-hmm. And I never, at least in my practice, we never push people to surgery. So, if someone comes in and says, I want a facelift, but they're not a great facelift candidate, I will straight out say, you're not a great facelift candidate. Mm-hmm. So, as long as if you come with a clear vision, at least in my practice, I can kind of tell you what I think will get you to that vision. And then I'm also the guy that's going to say, hey, that's probably not realistic. Sure, I can take your money and do it, but you're not going to be happy, which means I'm not going to be happy. So I don't even offer it to those patients. And I think one of the things that sets us apart, again, is that since we do reconstruction as well as cosmetic, we're not selling cosmetic surgery, because whether or not somebody signs up for a breast augmentation with me, for instance, does not make my bottom line. I still pay my staff. I still send my kids to school, all those things based off of just the recon I'm doing. So I have the luxury of being able to tell patients, hey, this is right for you, or this is not right for you. I think other things to kind of ask them are try to get a sense of what they really feel like they're good at and what they are comfortable doing. Mm-hmm. And then it's really a feel kind of thing. Hopefully by the time you make it to the office, you've already done the grunt work, mm-hmm. which is good school, board certified, that some decent, good reviews, nothing real bad reviews. Right. And you have a good sense of kind of what you're getting into.
Yeah, because there's a lot of trust when someone comes to you, like they're trusting you with their bodies.
So much trust.
And so I think that is important, to pick someone that you feel comfortable in the office, yes. You like the staff. And I think one thing that we had talked about just offline too, was that you are a one physician office. So when people call, they talk to someone, yep. They see you, and they don't have to worry about follow up with someone else.
Yeah, absolutely. We're a small office. We have a total of 4 people. My wife also helps. She's our social media director, and then me. We don't have a nurse practitioner. I don't have a physician assistant. So when you have surgery with us, you're seeing me. And I tend to oversee people. That's one thing my manager is trying to get me to stop doing. But I oversee people. And I essentially get to the point where I tell patients, look, I'm going to see you as much as you want to see me until you're tired of seeing me. Because I don't want anyone to feel like they're not heard, they're not listened to, and they're not taken care of. Because, right. That's important. And I always tell patients, what I do in the operating room, it's very important, obviously. But it's 2, 3, 6 hours. What you do after surgery, that makes a huge difference. That's 2, 3, 4 weeks, up to sometimes in months, depending on the case that I'm doing. Right. So, that's really important that people have that support network and that ability to call and say, hey, it doesn't seem right. What do you think? I get a lot of patients messaging me on Instagram, through Facebook, a lot of patients. And it's just my wife and I reading that. So sometimes my manager will jump in too. But, for the most part, that's another way for people to talk with us.
That's awesome. And before we dive into specifics, let's kind of back up and just talk about what are some of the most common procedures you do?
Yeah, so on the cosmetic side, I do a lot of rhinoplasties. I do a lot of blepharoplasties. So blepharoplasty is an upper and eyelid surgery, and that's getting rid of the hooded eyelids, as you all call it, and then the droopy lower eyelids, or the puffy eyelids. Mm-hmm. The rhinoplasty, I apologize, that's a nose job essentially. So straightening out the dorsum, the septoplasty, helping people breathe better. So that's something that we do quite a bit of. I do facelifts as well. In terms of the body, we do a lot of mommy makeovers. So I'm blessed to be in an office where moms want to hang out, which is great because I love, working with moms and, that demographic is a lot of fun.
Yeah.
And just making those women feel great about their bodies again. So a mommy makeover is a breast lift without implants and a tummy tuck. And with the tummy tuck, a lot of times the women have what's called a rectus diastasis. So their rectus muscles are separated, or they have a small umbilical hernia. And because, again, I do so much reconstruction, I can fix the hernias, the rectus diastasis, anything that really needs to be fixed. I'm very capable of doing on my own during that surgery.
So you're basically a one-stop shop.
I'm a one-stop shop. Yeah, yeah. It's amazing the breadth of what I do. And I didn't intend for that to happen, but part of that happened because of my recon side. So, when you get called enough times by neurosurgery and you get called enough times by orthopedics and you get that 50th gunshot to the face, now everything else starts to feel kind of straightforward. If I can put together some, like for example, today I did a chin implant. The chin implant is a very similar approach to a mandible fracture, and I do a lot of mandible fractures. So there's a lot of overlap, and you get to the point where there's nothing at this time that kind of phases or scares me. And, even with hernias, patients are always like, you can fix it. It's like, yeah, when general surgeons need help, I help them with their hernias. So, it's a really nice broad skill set.
That's great. And I know for those of you who don't know in the audience, I just had a baby 6 months ago. And so talking about some common misconceptions or myths maybe about that mommy makeover, like, do you have to lose the weight first or lose some weight first and then come in? Or can you just roll from the C-section OR into your OR? Like, how does that work?
So it's not common to roll from the C-section in RR. I do combine with OB/GYN when they do oophorectomies or hysterectomies. You can get a mommy makeover at the same time that they're doing that. That is a possibility. But in terms of the mommy makeover, typically you don't want to be breastfeeding for about 6 months, because when you're breastfeeding, your breasts are engorged with milk, and it makes it very difficult for me to obturate through that. You also want to be near your goal weight. That's a really good point, Brooke. So, if you are 20 pounds above your goal weight, get to your goal weight and try to stay there for a few months and then come see me. And when I say goal weight, I'm not saying the weight you were when you were 16 years old in high school and, running marathons. Right. It's the weight that you reasonably can maintain without some crazy fad diet for the rest of your life. Because if you get the mommy makeover too soon and you lose more weight, well, your breast can sag, your belly can get a little bit extra skin. Whereas the opposite, if you gain weight, then your belly gets bigger again and your breast can lose a little bit of their shape. Right. And I'm talking, these are fluctuations of, over 20 pounds I'm talking about here. Like, going between 5 and 10 or 15, probably not a huge deal. But for the most part, you kind of want to be in the zone where you're going to live. Okay.
So how long should people kind of wait or come through your door? Like 12 months after, do you typically see, or what's most common?
No, I say come see me right away. I mean, so I have moms who give birth 3 months later, they're in my office, because we do book, pretty, not super far in advance, but far enough that if you're looking at a specific date, especially around the holidays, it's good to come say hi and kind of let's get something on the books.
Good Christmas present.
Yeah, good Christmas present. Yeah, I love the holidays. Holidays are a very busy time. We got a decent amount of people who are also older, believe it or not, that come in and, they get to the point in their lives where they just want to treat themselves. They've done everything for their families and they've taken care of everyone else, and now they want to take care of themselves. And I think that's a really special time for them too. So we get those patients come in.
Okay, and then another big question is recovery and downtime, drains, like.
Yeah, for the mommy makeover.
Yeah.
Oh, yeah. So for the mommy makeover, we basically tell patients for the breast, depending on whether or not we put implants, especially, your limited arm use. And I always tell patients they're a Tyrannosaurus Rex, right? So what we don't want is you stretching your pectoral muscles or your shoulders, because if we put implants, especially, we want them to stay where we put them. So we try to limit that motion, which means you're not picking up your baby, so that's something to think about, especially if we're doing implants. Those are something to think about. But for the most part, that's only a couple weeks. And then for the belly, you're sort of hunched over. So back to my T-Rex analogy, you're sort of like, kind of hunched over a little bit, because I will pull you quite tight to make sure that you have the result that you want. And that's also a couple weeks. So, for the most part, you're back to, within a couple days, you're sore, but you're moving around the house. You're doing the household chores with the restrictions we just talked about. And most patients, by 2 to 3 weeks, you're kind of moving around pretty well. And by 4 to 6 weeks, you can start exercising and doing your thing again. We actually just operated on a patient who's getting married in 6 weeks. Wow. And I told her, I was like, we're gonna try. But she came in at the 3-week mark, and I think she's already looks amazing. And I don't think she'll have any issues with the wedding.
That's so great to see the results from start to finish.
Yeah.
To really follow with those patients over time.
Yeah, it's really special. Yeah. We have 2 weddings coming up. So we helped another gentleman with an issue he was having, and he's getting married in a few weeks too. So
wow.
I don't get a lot of wedding invites though. So if you're watching, I'll totally come. I love weddings.
Yeah, you gotta post the address after.
Weddings are awesome.
And so the face procedures you do, what are some of the common misconceptions or myths there?
I think one of the biggest myths is that we have total control over what we're doing. So I know there are surgeons out there that'll take a photo of you and say, hey, Brooke, look what I can do to your nose in some computer generated model. As an engineer and as a person pretty familiar with AI, I can tell you that what you see on a computer screen is not necessarily what you can do in an operating room. I mean, there's a lot of variables in terms of measurements, in terms of soft tissue quality, in terms of swelling. So I think if you think you can come in and say, I want this exact nose, and someone says they can do that, they're not probably being realistic with you. And those are the patients who are super sad. And I never do that. I again go back to what don't you like, or what would you like me to improve? And then I kind of tell you what's a reasonable thing. And that's how you have happy patients. And that's true for the rhinoplasty, especially for the chins, for implants, especially, and for blepharoplasties. I also do a lot of otoplasties. So patients that have prominent ears, I think that's a really interesting surgery. I do a lot of cartilage work when we do those, and those patients are exceptionally happy as well.
Now, is that considered reconstructive or the cosmetic for the ear surgeries?
Yeah, the ear surgeries, it depends. For the most part, it's cosmetic. Most insurance companies don't recognize prominent ears as a insurable code. But there are other ear injuries. So for example, like if your earring gets ripped out, that may or may not be covered by insurance because that is a trauma. So I do quite a bit of earlobe repairs and other ear injuries for patients. And I'm always amazed. As soon as I fix it, the first question is, when can I put my earring back in? And I'm like, really? Like, you just
You're
had
not
surgery?
worried about that?
Yeah, we just went through this. But the answer to that question is at least about 6 to 8 weeks before you can put another earring in.
Wow. And I know, you must encounter some people that went out of the country to do their surgeries or are asking for dangerous surgeries. So can you speak a little bit,
that's
about
actually,
that?
thanks for asking about that. That's a pet peeve for sure. I think patients, they see maybe a lower bottom dollar initially in Mexico or one of our neighboring countries, and they think it's a good deal. But what they don't realize is that, one, traveling across the border for surgery, it really complicates your follow-up care. So you may save a little bit of money on the initial upfront cost, but now you're going to a place where they may or not be certified. Their operating rooms may or may not be clean, and they may or may not really care about what you're doing. Because I can tell you in my practice, we get several patients from other places that they've called their surgeon, and their surgeon says, "Oh, go see someone else," because they've already taken your money. So for them, there's no reason for them to follow up with you. You don't even live there. So what are you going to do? So I advise highly against patients doing that. I think, when you start adding in airfare, travel costs, hotels, and then, God forbid, a complication, you're saving money by staying in the United States and going to a reputable place. Another thing I don't think people realize is they go to I've had this happen several times. They'll go to Mexico, for example, get a surgery, have a complication, and they'll call their surgeon in Mexico who will say, go to the emergency department. Well, your insurance doesn't cover that visit because you had a cosmetic complication from a surgery in another country. So now you're going to get a huge ER bill. And when you roll into any ER in this country, you're getting a CT scan or an ultrasound, you're getting seen by multiple doctors, and that's just racking up on you too. So really, the truth of the matter is, you're better off trying to call a plastic surgeon in your area that's willing to see you. And that's the other problem. A lot of the doctors aren't willing to see a complication because, it's just human nature. You've just paid somebody in Mexico $15,000 for a surgery. Why would we take on your complications for a $100 post-op visit?
Right.
So, it's something, and don't get me wrong, we'll always help when we can, at least in our practice, but it is a problem that I wish people would not do that.
Right. And also, you don't have the operating note. You don't have anything to really go off of. You just have the patient's story. And, I think it is important to differentiate travel, like someone, let's say, living in California that wants to come see you. That's very different than someone going to another place to get a surgery that's unsafe and out of the country. So I do want to highlight that because people might love the work you do online and your wife's social media highlighting your work. And they're like, I want to get to Scottsdale and come see him.
And we do actually have a lot of that. I'll say the majority of people that do that have family here, though. So I love that you said that, Brooke, and I appreciate you saying that. But I think having a support network here is also important. I do have patients that fly in for surgery. They stay for a couple of weeks and they go home, and that's fine to do. And also to my my colleagues in Mexico, there are great surgeons down there. Don't get me wrong. So, I'm not saying that they're not doing it right, but it's just more difficult when you're traveling across the border.
Right. And better for them to operate on someone local that can follow up with them then.
Absolutely. Yeah. And again, going back to your very first question for me, certified by the American Board of Plastic Surgery, because that is our gold standard. That means that someone has completed the appropriate training, passed all the tests. So that's kind of your initial benchmark.
Yeah. And now let's say I've called, I've seen you, I'm all in, I'm ready to schedule. Are there certain times when someone has to get medical clearance first or any certain kinds of clearance? Yeah.
So depending on your age and your medications and your medical history, you may or may not need a clearance by your primary care doctor. If you do see a cardiologist, most likely you'll need a letter from your cardiologist. One nice thing about our practice is, again, I work with so many doctors that we can definitely point you in the right direction. Just earlier this week, I helped a cardiologist replace a pacemaker, which is not a common thing for a plastic surgeon to be doing, but he's a very, very highly regarded cardiologist, and we do work together when he needs my help. So I can always call in favors. And actually, funny enough, the patient that has the wedding in 6 weeks needed cardiology clearance 2 days before surgery.
Oh my gosh!
And couldn't get it. So sure enough, I called one of my buddies
Nice.
at the Pinnacle Heart, I think. Shout out to you guys. And he got her in right, or Atrial Heart. I'm sorry, I'm not sure which, but they got her in right away.
That's
Gave her
awesome.
the clearance, and we were able to do the surgery.
Yeah, it's so nice to have the trusted colleagues where you could just call them up and be like, I have this situation. I need someone to be seen.
Yeah,
now.
it's amazing the network
Yeah.
I now have.
Yeah.
It's really incredible just because, I'm the guy that usually always says yes to other people, and people know that. So every week I get a new referral from somebody, and it builds my cosmetic practice. I can't tell you the number of doctors' wives I've operated on because, I helped them with something, and they know I have a good reputation. So they send their wife to me, or, actually my patient today was the significant other of a surgeon here in the Valley, asked me to do. So, it's
awesome.
pretty cool.
Yeah. Now that kind of leads to like what sets you apart from the other plastic surgeons, because if you're watching this and you don't live in Scottsdale, there is a plastic surgeon or someone claiming to be a plastic surgeon on every block.
Yeah, absolutely. I think it goes back to your initial question. I mean, I think one is the training, not to toot my own horn, so toot, but, training at Duke, I mean, that's a special school. And Johns Hopkins is, I don't know if you know, but the #1 medical school in the country, at least when I attended. And then my training at the University of Washington, several of my professors are very well known, even wrote some textbooks in the world of plastic surgery. So, that's one thing, and just really well trained. I think the second thing is that I operate a lot. So, I think one of my, I talked about this briefly, but one of my pet peeves is when someone calls an office and they're told it's 6 months until they can get in. That doesn't really mean much. It either means they're not operating that much, or they're just artificially like lengthening their wait time. It's almost like, the lines outside of a club. When you're standing outside the club and it looks awesome, and you go inside and it's like just a bunch of dudes and crappy music.
Yep.
Like that's kind of like the same thing with some of the offices. So I operate a lot. I mean, we do 2 or 3 surgeries a day.
Wow.
So, we might get you in 2 or 3 weeks. That doesn't mean that we don't have a lot of people. It's just mean my throughput is really high. But, that goes back to Malcolm Gladwell. So, if you heard about him, he wrote that book about 10,000 hours. I'm way over 10,000 hours at this point. So my proficiency in the operating room is pretty exceptional.
That's awesome.
And especially the breadth of what I do. So I think that's, again, the recon part of it. And I get complications from even our plastic surgery friends. So they're like, hey, Prucz, like, I did this. I don't really know what to do. Would you mind helping me? And yeah, sure. Of course I will. And I have great relationships with most of the plastic surgeons even. I talk with them about their cases. They talk with me about their cases. I think there has to be a certain modesty in what we do. So, if I know that I'm doing something that I don't do a lot of, but, this person does, then I have no problem calling that person saying, hey, what do you think about this? Or can you give me some tips on that? And then I think really our personality. I mean, I know we're joking around here, but we are fun. I mean, like I'm a pretty joking guy. Like if you ask anesthesiologists or nurses or even my staff about me, like we're a fun office, and you will not leave. You will laugh at least once and every visit at our office, because that's just kind of and even our staff. Our staff are great, and they reflect my personality. They're friendly and playful, and I think that's really important.
Yeah. Well, and it sounds like you have a special offer for our viewers too.
Yeah. So you kind of surprised me with that at the beginning. So I don't have the exact data, but if you call my office, should I give the number?
Yeah, please.
All right. If you call our office at 602-331-7811, I will figure out an offer. Okay. If you tell them, if you say that you're calling from the Scottsdale Top Doc
podcast,
Top Doc podcast, I'll make sure that we take good care of you.
Awesome. Well, thank you so much for taking the time to join us today from your busy OR schedule.
Yeah.
We'll let you get back at it.
All right. Thank you so much for having me. I appreciate it.
Thanks.
If you have questions you'd like a medical professional to answer, please write us and we can ask those questions for you at dr.amber@scottsdaletopdocs.com. You can also find us on Instagram, YouTube, and Facebook in our group, Scottsdale Top Docs. If you'd like to be featured on an episode, please make sure you reach out to Amber Enright, Dr. Brook, or Dr. Safna. You can also email us at dr.amber@scottsdaletopdocs.com.